Hi, I'm Dr. Robert Moore, and we're continuing our Build a Better Brain workshop of the brachial plexus, and today we're talking about the median nerve, which is the lateral and the medial branch of the brachial plexus that makes up the median nerve, and that's why it's in green right here. But that again is C5 through T1, these nerve roots in through here. The median nerve comes down, and remember the entrapment site's in the shoulder, but it comes down your arm, comes through something called the ligament of Struthers in people, the bicipital aponeurosis, the Pronator Teres, goes through in your hand to the carpal tunnel and supplies the feeling of your hand right through here, these three fingers and half of your ring finger on your palm side. It's in charge of bending your wrist and pronating your arm, so turning your wrist on like that. Remember, the radial nerve was for holding the soup, the medial nerve and the ulnar nerve, they combine for this, and then bending the wrist like that. Also in charge of bringing your thumb, has a lot to do with bringing your thumb out, flexing it, and bringing it in like that, opposing it. Now let's go through the nerve itself. Now the nerve comes around the elbow, comes through the ligament of Struthers. Now the ligament of Struthers is basically a bone, supracondylar notch, and it links to the median epicondyle in through here, and sometimes that ligament will get damaged. You break your arm, break your humerus, you damage the median nerve right in through here. And so people get what they call the Pope hand. They can flex these two fingers here, but not the thumb, the ring, the index and the ring finger, so they look like the Pope with their hand because they can't flex everything, make a fist and go like this. So it's the Pope. God bless you, God bless you, God bless you. That's what happens when you aggravate, you entrap the median nerve right about here. Bicipital aponeurosis will also trap it. Now then you have your Pronator Teres, and that's in charge of, pronation, turning your wrist down like that. Then the nerve runs through the Pronator Teres, and it comes, and that's the muscle here, and we get the flexor carpi radialis, the palmaris longus, the flexor digitorum superficialis, again, just flexing the wrist like this. And then we have the anterior neurosseous branch, which is your pronator quadratus, the flexor pollicis longus, and the lateral flexor digitorum profundus 1 and 2. Now, what's very important as the nerve travels through the Pronator Teres, if we have entrapment there, that's our third site of entrapment, then everything from here down is messed up. This whole, your hand is numb, and this part of your hand, right here, right by your thumb, the thenar eminence, that's numb. The whole hand is numb when this is messed up. Now, when the nerve comes down, you can see right here, there's a branch, the palmar cutaneous, the palmar cutaneous, this part of your thumb right here, that goes above the carpal tunnel. It does not go through the carpal tunnel to supply this part of your hand. The rest of the nerve goes through the carpal tunnel, and that controls the abductor pollicis brevis, the opponens abductor pollicis brevis, the opponens, which is also controlled by your ulnar nerve, and then these lumbricals 1 and 2 for flexion of your fingers like this. Now, there's also a superficial branch that controls the skin on these three fingers and half of your ring finger. So people will say, hey, Dr. Moore, I have carpal tunnel. But this part of their hand is numb. Now, if this part of your hand is numb, that means the interference to the nerve is way up here. If this part of the hand is not numb, and it's just these three fingers here, then the entrapment is here, it's not here. So if you have carpal tunnel syndrome, if you're being told you have carpal tunnel syndrome, and this part of your hand is not numb, this part of your hand is numb, then you have a problem up the nerve. Because the nerve comes through here, everything is bad here, and this, you will still be able to pronate your wrist. So when we do a testing and we have somebody, resist me pushing this way, they can hold it, but because this muscle maintains its connection, I'll drop the pen again. So I'm getting ahead of myself, making this a little too difficult. But if this part of your hand is numb, the entrapment of the nerve is here. if this part of your hand is not numb and these are numb, the entrapment is here. It's pretty simple. Most people will come in and will find out that this is numb. And so they got a problem here. And they could have a problem here too, but the problem starts here. So we got to look at the whole thing and just looking at one area. Then we also have to remember that we have 3 sites of entrapment of the nerve as it comes through here. So all of this means is that we have this median nerve controls this part of our hand, flexes our hand, pronates our wrist, and helps us with our fingers and helps make a fist. This nerve is very important. It's oftentimes injured, it's oftentimes aggravated. You injure your wrist, that's a big deal. So a great neurological exercise for that. What we want to do is we want to get better blood flow to that area there because blood helps the nerves. We want to activate the median nerve. So a great exercise is this. And if it's uncomfortable, don't go so hard. I'll see all kinds of people doing stretches on the median nerve. I don't know if I agree with that or not. If you have an injury, you can be aggravating the tissue in through there. So we like to do that. We like anything where you get blood flow. Now, a great exercise to again work your brain in this is neurokinetic accuracy test. Because when we do this, again, we are stimulating our opponent, we're stimulating our opponents, we're stimulating our abductors, we're stimulating our flexors of our hand, but we're stimulating the lateral part of our cerebellum for neural coordination. And we're also stimulating our brain over here. We're stimulating our brain over here, and our brain deep inside through here. This exercise, if you have median nerve problems, is a great exercise for your brain. There are plenty more for us to do, and this one might sound redundant, but it is a phenomenal exercise. And it does a great job of getting blood to the nerves, getting blood to the tissue in your brain, and getting your brain working better. So I'm Dr. Robert Moore. I want to thank you for watching these videos. We appreciate all your comments. We appreciate you liking us on Facebook. So please subscribe to our YouTube channel. Spread the word. Call our office if you have any issues. 810-225-7246. We will be glad to speak with you. And God bless you. Have an awesome day.